Hello, everybody. Thank you again for joining us for a second Bioflex Clinic webinar. I'm your host, Dr. Nathan, and Slava Kim will be joining us again to talk about today's topic. Don't worry, you did not join the wrong webinar. I know it says arthritis treatment there. It's because we want to do a quick review of what we covered last webinar, which was how laser therapy can help with arthritis. So we'll go through just a quick few slides for everyone who missed that. That recording is also available on our website. And same with today's webinar, we'll record it for anyone that didn't join or can't stay for the whole session. You'll be able to review it again. Some quick housekeeping things again. There'll be some short breaks in between the webinar slides, which we'll be able to cover some questions. At the very end, there'll be a 10 to 15-minute Q&A session where we'll be able to take some more questions. Feel free to type them in the chat box or the Q&A box. We'll try to get them. If we do miss some of them, we apologize. You can always follow up with us via email. Our emails will be posted at the very end of this presentation. Also, any personal health questions, again, save those for email. We'll definitely get a chance to reply to them if you do send it to Slava or myself. And I just want to thank everyone again for attending and for submitting all those questions prior. Other than that, Slava, we can go to the next slide, which last time we covered arthritis. So major topic is osteoarthritis. It is one of the most prevalent arthritis types that people suffer worldwide. Some personal facts there. It affects a lot of Canadians. Since we have an aging population, and they do predict that by 2040, 12 million Canadians are expected to have OA. So very important to know that laser therapy can help with OA. It is a leading cause of disability, and because of that, also causes increasing chronic conditions such as hypertension, COPD, depression, and fatigue. And then we can go to the next slide. So in summary, we covered different case studies of how at our very own clinic, we've been able to help patients who suffer from osteoarthritis. Major benefits of laser is it helps eliminate pain, avoids the need for drugs, surgeries, and helps many individuals restore the normal range of motion, which is often limited due to the arthritis. And overall, you get an improved quality of life. Myself personally, I go through kind of knee treatments regularly, even though I'm only 42. I want to be preventative about this. I'm not waiting till my joints start to hurt that I start to do the laser. So there is a preventative measure that we see with the laser as well. And then covering the benefits of laser, very safe, non-toxic, non-allergic, non-invasive. There's no pain during the treatment. There's no side effects, no complications. Very cost effective when you compare to doing many different treatments that don't work, or even like think of doing surgeries, things like that, or taking medications. And the major important thing is it's not contraindicated for patients with pacemakers, metal implants, which is important for today's topic when we talk about bone regeneration and restoration, prosthetics, transplants, and anyone who's taking medication. So that's a summary for the last webinar we did on arthritis. You can definitely view that again online. Today's webinar is on bone regeneration and restoration. We'll learn about this from Slava. If you have any questions, pick his brain. He has 2 decades of experience in laser therapy. And we have a special treat today. He has his creative side. So he actually developed some of these images by himself with the assistance of Dr. Chad G. Patel. Specifically, pay attention to the effect of laser therapy on bone regeneration image and the knee replacement image. He took some time to kind of create those himself. So without further ado, Slava, thank you. You can take over and we can start the presentation.
Thank you, Nathan. And hello, everyone, and welcome to a beautiful spring season. That's why you may ask me, why is it that we want to talk about bone regeneration and restoration? And the main reason is that soon after the winter season, we're still dealing with a lot of consequences. Not to mention, every winter season, we see patients at our clinic with those particular challenges. And the most common situation would be slip and fall accident. when people fall down on the slippery ice surfaces, breaking their bones. Of course, they go to ER. They would be seen at some fracture clinics, and then they would be offered to have immobilization in the form of a casting or removable cast. And then we see that soon after pain medication be prescribed, some basic recommendations provided. They say, now just go home, relax, rest, and somehow at any point in time in the future, the bone will heal itself. And this is not really the best option for those patients because we live during very busy times. Everyone needs to do certain things, going to work, pay the bills. Students, they need to go to their colleges, universities, and schools. So that is why everyone is in a hurry. And the question is, seriously, in 21st century, there is nothing else you can do but just sitting on a sofa, watching TV, and consuming pizza. So bone regeneration or bone fractures, very common but still complex and quite challenging injuries that often require substantial recovery time. And again, this is the only option that is offered these days by healthcare practitioners, just sitting and waiting for that bone regeneration to happen. In some more severe cases, more complicated cases where fracture would be, as it's called, fragmented, patients undergo surgeries. It is called open reduction and internal fixation, or ORIF. So it's widely used surgically to stabilize, to align bone fragments, to restore the anatomical integrity. And sometimes they use a different kind of hardware, like titanium plates, wires, screws. And however, even after a successful surgery, recovery can be still prolonged, and complications like delayed union or non-union will be coming, chronic pain, RSD, CRPS, all of those unpleasant consequences can happen. So traditional treatments such as grafting, implants, fixation devices often involve invasive procedures. Hospitalization is necessary, waiting times involved because patients need a highly specialized help at the time, and then followed by extended recovery times again, and potential complications. Every time there is a surgical procedure involved, there is a high risk of internal bleeding or infection afterwards. And in recent years, laser therapy has emerged as a non-invasive, cutting-edge approach with the potential to revolutionize the bone healing process and regeneration due to its physical ability to deliver the energy to those tissues. So by harnessing specific wavelengths of the light to stimulate cellular processes, laser therapy offers a promising tool to accelerate the bone repair, to improve patient outcomes in orthopedic medicine. This is how a normal bone regeneration or bone healing process would look like. Look at that in week 1, during a very acute stage of inflammation, soon after the injury, there would be hematoma formation or intra-tissue blood pooling. So technically, even though it happens in response to broken blood vessels, the body will utilize those blood cells as the building blocks, building materials later. So the second stage, which will be somewhere in between 2 and 3 weeks, this is when internal callus formation will start forming. It's a spongy type of substance, like a framework when you look at any kind of construction site. And then stage 3, the actual callus ossification. We're going to see a more stronger, more pronounced framework that takes up to 1 to 4 months normally. And that only within 9 to 12 months we can see, confirmed by X-ray, consolidated fracture healing. As you can imagine, even a small injury, a small fracture can be prolonged up to almost a year. Now, laser therapy works on the principle of photobiomodulation. We have learned that previously. And when applied in bone tissue, laser light stimulates cellular processes at the cellular, at the molecular level. And it is very essential for bone repair and growth. So this process encourages the activity of osteoblasts. Those are bony cells responsible for bone formation. Osteoblasts, osteoclasts, and while promoting collagen synthesis, and improving blood circulation to the injured area. It just brings mobilizing all of those building blocks like bricks to the construction site of a new healthy bone formation. So when you look at the microscopical level, what's happening, you see how the blood flow, the white cells, will be mobilized to accelerate the healing process and going through those stages of the inflammatory process. So this is how we know that old or damaged or dead cells will be removed. The inflammatory markers will be neutralized. The products of the inflammatory process and metabolic toxins will be also washed away through lymphocytes. And then macrophages will be consuming those dead cells and outdated cells so that there will be a clear passage, clear way, open space available for a new healthy bone tissue formation. So the question may be, how do we know what exactly is happening at the cellular or molecular level? And once again, I'm happy to tell you that in 21st century, a lot of research has been done specifically on the mechanism behind bone tissue regeneration and healing.
Yes, so there was a question that was submitted before if laser therapy can be applied to the cast, or sorry, over the cast, or if there's a brace after a fracture surgery.
The laser light, because it's the light, cannot penetrate through any physical, mechanical barriers, obstacles. So that is why the only way to apply laser over the site of the fracture would be to have a direct access. But interestingly enough, what we've done, if let's say patient would have radial ulnar fracture in the upper extremity, we can actually treat the area above the cast, below the cast, and by doing so, remember the blood flow, white cells, red cells, even by treating those adjacent areas, you can expedite the healing process because the body with the blood flow will deliver oxygen, proteins, all of those important, valuable elements for bone regeneration and healing, including collagen production. Okay, I see that it's uploading. Maybe because of multiple illustrations and images, there was some technical glitch.
Does laser treatment help with an old fracture that has not healed in the past?
The short answer is yes. Those non-healing fractures called non-union fractures. And unfortunately, it can happen in few common situations, such as, let's say a patient at certain age would be also diagnosed with osteoporosis. And as you know, the bone density will be not perfect, not be ideal. Plus, metabolically, after the age of 40, 50 years, we slow down with cellular proliferation. And this is when laser can expedite the healing process. I've had those patients in the past, I've treated them successfully. And another reason for that would be non-union fracture. If soon after the injury, soon after trauma, bone fragments, they have not been in that physical contact with each other, and perhaps the alignment wasn't proper, then they should be realigned, and then laser can expedite bone callus formation and regeneration. So how do we know in a detailed fashion how laser works? Well, like I said, this subject of bone regeneration, bone healing is now well understood because it's been researched. So I would like to share with you only very few articles on this subject, photobiomodulation therapy in bone repair, and it's a systematic review. Look at that, laser therapy with specific dosages, particularly focusing on protocols. And once again, what caught my attention is exactly this, using gallium aluminum arsenide. This is the semiconductor that we use in our laser technology in Bioflex, gallium aluminum arsenide. And the wavelength, exactly what we have, 830 nanometers. This is the near infrared spectrum, which demonstrated positive outcomes in bone repair. So also different studies applied varying treatment durations and frequencies. Again, I'm happy to tell you our technology allows us to adjust any physical parameter of the light, including frequency, duty cycle. And then we see that we can influence the effectiveness of photobiomodulation therapy in enhancing bone regeneration. Great news. This article was published in 2023, International Journal of Molecular Sciences, The Role of Laser Therapy in Bone Healing, also a systematic review. The value of systematic reviews is that they look at different publications around the globe. They take and summarize the essence of it. So in this article, they have highlighted the effective laser therapy for bone healing, typically involving specific dosimetric parameters, including wavelengths. Again, you can see the red spectrum and infrared spectrum. That's what we have in the Bioflex technology. The energy output, very important also for us to know what will be the optimum. As I mentioned previously, more does not necessarily mean better. And these parameters are crucial for optimizing the therapeutic effects while minimizing potential tissue damage, as treatments outside these ranges may be less effective. This one, also published in Lasers in Medical Science Journal in 2023, effects of photobiomodulation or laser therapy in the treatment of fractures, also a systematic review and meta-analysis of randomized clinical trials. This is what is called the golden standard of any research in any field. And in this article, we see specific dosages for laser therapy utilized in this study, including treatment of 9 joules per centimeter squared, applied for 50 seconds per point. You see, it tells us what's the dosage, what's the duration, with accuracy to the second. And also what I like, specific wavelengths indication. We can see the red light, 650 nanometers, and the infrared spectrum, 808 nanometers. The benefits of the therapy include significant pain reduction, enhanced radiographic signs of bone healing, meaning that we can see on X-ray images how things are happening, demonstrating its potential effectiveness in fracture treatment. So this is actually a summary of what I was just talking about from the research. How laser therapy can help us to expedite bone tissue repair, regeneration at the cellular molecular level. And the beauty of this technology, once again, effectively, non-invasively, to travel through the layers of soft tissues, and we can target specifically the fracture zone, exactly where the cellular excitation should be taking place. Also, it is important to remind that ATP production within every cell will be boosted up to 3 to 5 times more than normally it would take. That is why we don't have to sit and wait passively. We should be initiating the laser stimulation, bone regeneration as soon as possible, as soon as patients would have access to this healing modality. And I will pause, Nathan, at this time. Perhaps we have received a few questions.
There is one question here. Dish in the cervical spine, neck movement is limited. Told that it's only at 1 disc level. Can Bioflex laser actually help reverse or break up calcification that is restricting movement?
Okay. So in general, osteophyte formation, calcifications would be happening in response to chronic inflammation. And this is how the body is trying to immobilize or stabilize a certain segment of the spine. So now we have to think in a different way. If we can stop further escalation of inflammation, and if we can control that area, preventing from more calcium buildup, then yes, we can do that. Then the body will be able to reabsorb whatever has been accumulated. If unfortunately calcifications and osteophyte formations far gone and they're so significant in size that it may cause a permanent damage to the nerve or the spinal cord, then only surgical intervention would be possible to free up some of that space that would be occupied by calcifications. Thank you.
Thank you, Slava. We'll take one more question. how many treatments, just as an estimate, obviously we would never be able to be exact, would it require for a broken ankle that needed screws and plates to be placed in the area fractured? And what would be the ongoing frequency of treatment?
Well, I have a good answer, and it's coming soon in a few minutes. I have pictures, I have x-rays, I have a specific case. So let's just wait a few minutes and we'll get to that answer.
Then maybe we can continue with the next slides.
Wonderful. So the first case I would like to share with you, 8-year-old female who tripped and fell, landing on her right arm and breaking the top of the humerus on the right. And she's been admitted to the Sandberg Hospital ER department for examination. X-rays followed by CT scan revealed anterior inferior subluxation with a possible fracture through the base of the greater tuberosity, possibly surgical neck of the right shoulder. I know it sounds very complicated, but simply put, the shoulder was dislocated and the fracture took place at the upper third of the shoulder bone. So then you can see mildly displaced, and she's been provided with the shoulder mobilization. She was given an arm sling, discharged from the hospital after pain medication administration. And please take a look. This is how this fracture looks on the inside. You see the surgical neck goes right next to the actual shoulder joint, okay? And dislocation was, meaning it came out of that socket. So this is what I saw on the first day when patient came for initial assessment consultation. And now you can understand even casting would be impossible. There was massive soft tissue damage, bruising. You can only imagine like how much blood would be pooling in those soft tissues, not to mention the actual fracture underneath. And considering the age of the patient, 80 plus female, a certain degree of osteoporotic changes. So she was in a lot of pain, in a lot of suffering. And she says, Slava, you've treated my knee in the past, my low back. I was wondering if laser can help me with this situation. And there was no doubt in my mind. I said, yes, let's begin as soon as possible. So the reason why I'm showing you treatment protocol today, because I've mentioned in photobiomodulation, what matters? Time, duration, dosage, power output, frequency, duty cycle, all of that creates an optimal treatment regimen for the best possible outcome. So that is why in this case, you will see initial set of parameters. Those are the 6 minutes duration per application per red light and infrared, because we wanted to maximize tissue irradiation and tissue saturation. And then after a few treatments, we have changed those settings, those parameters, increasing the intensity. And then treatment number 11, as you can see, this is the answer to the question of how many treatment sessions would be necessary. What is the frequency of treatments? This is what's happening along the way. After 2 weeks of treatments, patient was introduced to the use of a portable Bioflex mini port system for home use, and she continued treatments at home following instructions provided by the clinical staff, and currently medication-free, undergoing physiotherapy, focusing on regaining range of motion in that shoulder. So you can see before and after pictures. And perhaps you may recognize even pressure points from those superluminous diodes from our treatment arrays, meaning that I took that picture immediately after the treatment session. Next case, a 15-year-old high-level competitive gymnast jumped from the trampoline backwards into the mid-air and sustained a FOOSH injury. So FOOSH stands for fall onto an outstretched hand injury during the fall. X-ray showing fractures of both the radius and ulna on June 11, 2024, open reduction, internal fixation, surgery with titanium rods in both the radius and ulna. Okay, so the surgery was performed 24 hours later at Sick Kids Hospital, and then further rehabilitation has been recommended. So please take a look. I'm showing you the original X-ray images and you can see both of those bones fractured right through, radial and ulnar. Also, this is the side view. You can appreciate that obviously they were not aligned properly. There is even some fragmentation. So that is why orthopedic surgeons decided to go for surgery with her. And this is the x-ray after surgery. We can visualize those two metal rods, you see, from the top to the bottom. So that helped to put fragments together so that she will heal properly in the future. Also, the side view, you can see those rods, they're doing the job, okay, allowing the fragments to stick to each other. And this is when we initiated laser treatments. Again, the idea was to surround the fracture zone, like in a sandwich approach, as we call it, to maximize tissue saturation and to deliver all of that photonic energy to the bottom where the fracture zone is. Initial set of parameters, then after 5 treatment sessions, we have changed the intensity, making it a little bit stronger. And then you can see the follow-up x-ray. Take a closer look, please. Indeed, there is a bone callus formation. You see even the periosteum helping us to restore the anatomical integrity of both of those bones, even in here where the fragmentation took place. Look at that. It looks exactly what I was showing you on those schematic illustrations. After 1 month of a rental Bioflex portable system use at home, patient has been re-evaluated by supervising orthopedic surgeon. A follow-up x-ray revealed satisfactory bone callus formation in both the radius and ulna. Bone fragments positioned into their normal alignments, and she was cleared for training in gymnastics. Look at that. Not only the anatomical integrity of fractured bones had been restored, but also she was cleared for training. You see, when I think about that, it just hard to even imagine that it's possible to do so. Once again, I'll take a pause. Nathan, do you have any questions?
Yeah, I just touch upon that last case. Yes, that was I saw her, I remember, and it's very interesting because even if you go back to those slides and look at the pins, it's a very odd way for the surgeon to kind of put the pins that way, and I actually do have another update on that. So they actually went back and removed those afterwards. And by the same token, when you remove something, you create trauma to the air, and the parents were so pleased with the treatment, they actually post-surgically of the removal, they actually rented the system again. And another update is she's training again, so inherently they go through these injuries. So her most recent injury was to do with her back. She's undergoing physio as well, but noticing that the physio isn't helping much. And again, with the rental system, it has helped them, which kind of ties into one of the questions that someone had. Is it safe to combine the laser while having physiotherapy exercise at the same time?
It's not even safe, but I think it's the best possible combination. The main issue that every patient would have with a situation like this, it's pain, it's stiffness. They feel very uncomfortable following those recommendations on exercising. But laser therapy does not only an excellent job with the healing and the regeneration, but also with pain relief and inflammation reduction. That is why when you combine laser therapy and rehabilitation exercises, that's the best.
We have question about, are there specific types of fractures that an individual should consider laser for? So I think this is addressing like whether it's like a non-union fracture, a fracture that is, I guess, due to some form of severe chronic condition. Are there specific fractures that laser works better for?
Well, from my personal observation, laser works the best in fresh cases, in young individuals, especially in athletes. Why? Generally healthy individuals with excellent metabolism, non-compromised immune system. This is what they need. Proper alignment of those fractured fragments and laser stimulation. They respond to the treatment beautifully. Obviously, we don't have a choice when any patient can come and say, well, I need help, and this is what's happening. So we welcome everybody. But in terms of expectations and the pace of healing and regeneration, that's what I'm saying. It happens better, more beautifully, and actually, a few more slides I'm going to show you. You will see that. And this is the answer to that question about ankle injury. 30-year-old engineer got injured during the soccer game on October 4th of 2024. X-ray showing fractures of the fibula and posterior aspect of the tibia. So both bones fractured. Open reduction and internal fixation surgery, ORIF with plates, screws, took place on October 7th, 3 days later. And then he was casted soon after. Further rehabilitation has been recommended. So look at the X-ray, original X-rays, and you can see those fracture zones at the back and fibula fracture. So that is why both of them, it's called syndesmosis, also wasn't perfect, wasn't ideal. And this is when orthopedic surgeons decided to go for ORIF fixation. Now, you see, the syndesmosis was restored, both bones positioned properly. You see the hardware, the titanium plate, and then 1, 2, 3, 4, 5, 6, 7, 8, 9 screws. Okay, so by looking at this X-ray, some of you perhaps will have some bony pain and aches, right? But imagine how it feels on the patient's side, on the inside. So the permanent cast has been removed on the 7th day after the surgery due to increasingly excruciating pain in the entire lower extremity. So this is just one sentence. But I remember that day when patient's mother called me desperate. She says, we don't know what's going on, why he's experiencing so much pain. Doctor's office doesn't answer the phone. So I said, listen, I know what's going on. After the surgery, the cast that they placed on that fracture zone has become very tight. It's too tight. So there is growing edema, swelling. And that is why nerves being squeezed, experiencing so much pain. Plus, he will be at risk of developing ischemic changes if there will be not enough oxygen supply to soft tissues and the bone. He will develop gangrene. So I said, please take him immediately to the hospital, ER, and simply demand remove the cast, and you will see what's happening there. So she listened to me. She did so. And then she said, thank God we listened to you. Indeed, his extremity, his lower extremity, was at risk of developing ischemic complications. So then straight from the hospital, they came to the clinic. And we've started his laser therapy. So this is what I saw. Yes, there was a post-surgical dressing covering the surgical incision on the outside. But look at his foot, look at his ankle, the entire lower extremity. Most definitely, if that cast, that very tight cast would be sitting, he would be slowly but surely developing gangrene, and then he would lose his leg to amputation. So the treatment itself, as you can see, there were 4 placements. So we've had to treat a lot of tissues, not only the fracture zone, but now we would have to fight for those soft tissue damages. We wanted to improve peripheral vascularization as soon as possible, oxygenation. We wanted to revive all the tissues, and then obviously to deliver as much of that energy as possible, utilizing laser probes directly into the bone tissue. Treatment number 3, this is when we have modified treatment parameters. Duration stays the same. And then look at that. The healing in place, significant reduction of that swelling, edema, erythema. Now, by looking at this picture, you can see only those surgical strips, but you can even visualize some skin lines. You see skin wrinkles, meaning swelling reduced, inflammation subsiding, and he was feeling so much better. So we continued with treatments. Look at that, treatment number 9. Also, we have modified treatment parameters moving forward, upping the power output up to 100% on laser probes. And look at that, beautiful, clean, healing. You see no more stitches, no more staples, no more redness. So this lower extremity was out of that danger zone, out of that crisis. But we still continued with bone regeneration. Observing the soft tissue healing is wonderful, but our final objective is bone regeneration and restoration. So here's another example of a lady I've treated in the past. Same story, slip and fall accident, fracture, surgery, ORIF, and then surgical staples. So she came to the clinic 3 days after the surgery and responded very quickly. You see, beautiful recovery without any complications whatsoever. Now, this volleyball player, I remember age 38, during the volleyball game, he jumped up along with his team captain. So he landed first on his feet, and then team captain landed on his right foot. So he sustained severe soft tissue damages and foot fracture. So the X-ray, this is the X-ray report, revealing nearly undisplaced intra-articular fracture through the base of the fifth metatarsal bone, and then there was a fracture cleft 1 millimeter. So technically, is the fifth bone in the foot on the outside fractured with some spacing in between fractured zone. So we've been treating both soft tissue damages and obviously underlying fracture. And you can see the outcome. That was the day when I've told him, you don't need this cast anymore, and you don't need those crutches anymore. And this is what we call at our clinic a hallelujah moment, when canes, crutches can be dropped and patients start walking normally again. Once again, Nathan, perhaps we have a few questions.
I actually just realized something. We should actually clarify what type of laser is actually safe to kind of administer over metal, stitches, staples, plates. Slava, if you could clarify, because there are different types of lasers out there. Not every laser is the same. At our very own clinic, we obviously use the Bioflex laser that our company has created. But there's different classes of laser. If you could kind of touch upon that, that'd be great.
This is a very good point, Nathan. Laser safety, and this is when we have to pay attention to laser power outputs. So our Bioflex laser technology belongs to class 3B medical laser devices. 3B. Class 4 or high intensity lasers. Those, the power output is measured in watts. Our lasers measured in milliwatts, meaning Bioflex laser does not have a physical ability to cause any damage to the soft tissues or bones. It doesn't have that much power to burn or to cause any cellular damage. Class 4 high-intensity lasers, unfortunately, they may heat up the tissue, foreign objects, or even superficial burns. That is why they cannot touch the skin directly and keep in one single position even for a few seconds. There will be imminent damage. So that is why I'm happy to tell you our laser technology, class 3B lasers, absolutely safe. And that is why we can treat safely children as young as 3 and 4 and 5 years old, and seniors, and anybody else with any foreign objects. It is absolutely safe to apply over surgical staples, stitches, surgical strips, etc., because they will allow the light safely to go through, stimulating surrounding tissues, and there will be no interaction of any kind between the light and foreign object. Thank you.
Okay, another question that we had was, are there any specific vitamins or supplements that should be taken in conjunction with laser therapy that would speed up fracture healing? I do think you actually have this covered in the next few slides.
Thank you. Yes, yes. Wow, we're receiving really nice questions. And again, I'm happy to tell you I have the answer. It's coming few slides later. Yes. Short answer is yes, but I will show you specifically. Yeah.
And then one other question before we continue is laser therapy for fractures covered by insurance? The answer to that is yes. It does obviously vary from plan to plan whether you can cover it under chiro or physio. Generally, at our very own clinic, we cover the laser through our chiropractor or physiotherapist. And it's always important just to check with your plan how much coverage there is. I do know, like, if you specifically cover it under laser, typically you may get less. So I always explain it as you're covering it under chiro, physio, as it's managed by those clinicians. Slava, I guess we can cover the remainder of the slides where we can answer the vitamin and
Wonderful.
supplementation.
Okay. All right, all right. So the next topic, subtopic I would like to mention, not only bone regeneration, but restoration. And that is why I have this picture for you. Also, we have treated and we are treating currently patients soon after total knee replacement surgery. And why is it so important? Because during this surgery, orthopedic surgeons would remove the original damaged joint surfaces involving both ends, the femur bone and tibial plateau. Then the artificial joint would be installed. And what happens then? Again, they will say, now go home and rest, do some exercises, physiotherapy, rehabilitation to regain range of motion. But we have to wait for this consolidation to happen. And now just imagine this foreign object, and this is the original bone of the human body. So what will be happening in here, in this particular zone? The immune system of the human body will be trying to fight off. So that is why there will be a lot of discomfort. There will be a lot of pain in those first few days and weeks, sometimes even months. Will be quite painful, very uncomfortable, because the entire joint will be swollen, red, hot to the touch. And then you hear this from physiotherapists. Oh, you have to exercise. Oh, you have to move it. Oh, you have, to overcome the pain. Suck it up. Patients don't like that. So this is when we can say, hey, safely, we can use our laser. We can help you with the healing of not only soft tissues on the outside, but also on the inside of the knee joint. And this is what we've seen in this case. 82-year-old female patient. She came soon after total knee replacement surgery. You can see even those post-surgical staples. And then she's been told, okay, now go and listen to a physiotherapist, start your exercises. What we have noticed below the knee joint, look at that, bruising, hematoma, swelling, lymphostasis, venous stasis. And physiotherapist was concerned, thinking, wow, if she's an elderly lady and I'm going to put you on exercise regimen, she may develop either thrombophlebitis or blood clotting situation. And then what? More serious cardiovascular complications. So she said, I'm a little bit concerned. We're going to do something about it. This patient came to the laser clinic, and we were healing two areas at once. The actual post-surgical site and down below the knee to improve, to enhance peripheral blood circulation, to accelerate resorption of this bruising, to minimize any potential risk for her cardiovascular system. And this is exactly what happened. You see, she healed beautifully. I was helping her to remove even post-surgical staples. And look at that. Beautifully looking, healthy, lower extremity. No more swelling. Because here you can see even pressure marks from her socks. And I'm happy to tell you, this is the case we're currently treating. So it's very fresh. As they say, fresh straight from the oven. I took these pictures just for you yesterday. This patient underwent total knee replacement surgery just a month ago, and look how nicely he's healing right now. Look at that. Beautiful. So look at that. Swelling, edema, resolved. Now he is free of crutches, cane, walking straight, exercising. Yesterday, after I took this picture, I've asked him, now, anything for the rest of the day? He says, believe it or not, I'm going to buy some plants, and we're going to plant those plants and flowers in my garden. I feel so good. I want to do some gardening. That's amazing. And look at that. Only 6 treatments. That's quite amazing. In the same way, we can help patients soon after their hip joint replacement surgeries, speeding up the healing, the recovery. Obviously, enhancing the outcomes of post-surgical site healing. Again, we're looking at the surgical stapes in the lateral aspect of the hip joint on the right-hand side. Look at all of that erythema, bruising. It's a significant trauma to those soft tissues, to those big muscles, but also we help the body to heal on the inside, to restore the integrity in between artificial joint and original bony tissues, femoral bone in this case. So a quick summary. Laser therapy helps us to achieve a few things at once, safely going through all the layers of tissues from the surface of the skin to enhance blood circulation, to boost collagen production, to regenerate those damaged muscle fibers, reduce inflammation, pain, to promote cartilaginous formation, and most importantly, the topic of our conversation today, bone formation. Now, we do suggest to our patients, especially having systemic inflammatory conditions such as degenerative osteoarthritis, degenerative disc disease, some other systemic issues, to consider switching to anti-inflammatory diet. In these days, there are a lot of good quality resources available. One of them, I would suggest, please check with Harvard University. They do investigate the research. They share that information generously. So please, anti-inflammatory diet and supplements, vitamins and supplements. So please take a look. Those are the vitamins that you should be taking daily. Okay, vitamin B complex, coenzyme Q10. CoQ10 is especially important in combination with laser therapy applications and photobiomodulation for ATP production boost. Vitamin C for angiogenesis, immunity, vitamin D, especially when we're talking about bone tissue formation and calcium metabolism, vitamin E, omega-3, vitamin A, folic acid. You can take it only 2-3 times per week, and microelements, minerals such as zinc, selenium, magnesium, manganese, boron and silicon. Boron, silicon, manganese, magnesium, selenium, specifically for the bone regeneration purposes. So please make a note of that. So this would be my answer to your question. And in conclusion, laser therapy has emerged as an effective treatment modality for fractures, primarily due to its ability to enhance the biological processes involved in bone healing at the cellular molecular level. The pathophysiology underlying this therapeutic effect involves interaction between the light and cellular components, so particularly through excitation of mitochondrial activity, ATP production. So this process facilitates various cellular activities, including proliferation, differentiation of osteoblasts and osteoclasts, the bony cells responsible for bone formation. And once again, this is the summary. When laser can effectively help us to boost up to 3 to 5 times faster than normally this would take place, when sometimes orthopedic surgeon says, do nothing, go home, watch Netflix, and enjoy your pizza.
There was a question that was on kind of a old fracture. It was actually pertaining to the collarbone. I think this person has had the fracture for over a year now. Is it too late to start laser even at this point?
No, it is not too late. But personally, I would like to see the actual X-ray image, because that would give us some information. Normally, collarbones or clavicles, they're really nicely healing bones in general. That is why lately nobody wants even to touch them surgically. But let's schedule an assessment consultation, and please bring with you the images. We're going to take a closer look at why is it not healed yet.
There is another question on, so let's say the individual cannot get to the clinic due to inaccessibility, and they're in the wheelchair. Is there a way to do laser at home?
Yes, we can schedule a video call consultation remotely. Once again, so that we would know the details, the particulars of the case, also to see X-ray images, and then we can make arrangements to have a portable rental system. Easy to use, easy to apply. Again, following the consultation, we'll be able to customize and prescribe treatment parameters accordingly, according to that specific case, and give instructions how to use it at home. Thank you.
So we have some attendees that have their own portable systems already. So whether it be a previously purchased system or one of the personal systems, question is like, is laser probe necessary?
My immediate answer would be yes, especially because knowing the anatomy of the human body, knowing that there are so many bones of different size, density, I would say laser probe is very instrumental, very useful when it comes to larger bones, shoulder bones, femur bones, tibia, fractures, especially post-ORIF, post-surgical situations, or slowly healing non-union fractures. This is when laser probe is a very effective instrument.
Thank you, Slava. Individual has a question. Previously had a slip and fall, pelvic bone, fracture of two places. They just want to know how to be sure that everything is healing properly. Obviously, this is followed by their medical doctor. I would gather that the only way to be certain is they usually re-X-ray at fracture clinics. Is that correct?
That is correct. So every orthopedic surgeon would follow a certain timeline. So initial, then follow-up X-ray images so that they could check what's going on if the patient is within those expected timelines. So a series of X-rays, sometimes if the patient is female and it's a pelvic bone and the patient is of a certain age and there is a question mark about osteoporosis, perhaps delaying, slowing down bone regeneration, orthopedic surgeon can arrange bone density test, okay, to look into that aspect as well. Thank you.
Yeah, I think this is where like it'd be great if they would just recommend laser, obviously. And I mean, we do have some medical doctors starting to recommend laser, which is promising, and it's they're recognizing its efficacy. But yeah, like for a non-uniting fracture or something that's slow healing due to metabolic changes of osteoporosis, like it is something that is should be implemented as a part of the rehabilitative process, not just physiotherapy and follow-up visits, but something to get the body cells active in the overall healing process, right? I'm trying to see if there's any other questions, and then I'm also reviewing some of the online submitted questions before. It doesn't look like we have any more. There are some, Slava, that we'll kind of get to because they were more personal questions pertaining to health concerns. But I don't see any other questions, and we can always answer the questions as our emails are there. Please feel free to send us an email, even call the clinic if we're available. We'll answer them accordingly. But once again, we want to thank everyone for taking their time to attend this webinar. It's our second one. We hope to do many more. It's going to be recorded, so you can definitely view this one and also the arthritis one. Someone just, yeah. But other than that, once again, I apologize for the glitches. Don't know what happened there, but we were able to finally get through the slides. Thank you, everyone, again, and we hope to see you again soon. Take care.
Thank you. Apologies accepted. Thank you.
Have a wonderful day.